Good day, my name is Samantha Flornosas, and today I will be performing on how to prepare medication from a vial and an ampule. So before preparing the medication or withdrawing that medication, first I'm going to do is to check the doctor's order. This is to determine what medication is to be administered, what dosage, and which site the medication should be administered. Next is I'm going to check the patient's MAR or the medication administration records. Upon checking the MAR of the patient, I have to compare it onto the prescription that the doctor's given to me, or the label of the medication that is given to me, so that I know that the right medication is administered to the right client. After making sure that the label of the medication is appropriate onto the patient's EMAR, I am now going to do the 3 steps on checking the medication. So first I'm going to do is to read the label of the medication, and then locate when is the medication taken from the cart before the withdrawal of the medication and after the withdrawal of medication. So this is important so that this is to avoid doing an error in administering medication. So after doing those 3 steps here, after doing that 3 steps, I am now going to organize the equipments I need to use. So I have here a 2 syringe. This is for the ampule and the vial. I have here the alcohol swab, an ampule, a vial, and a filter needle, as well as an alcohol and a clean working gloves. So now I am going to prepare medication, and I'm going to prepare medication from a vial. So first I'm going to do is to perform a hand hygiene and observe other appropriate infection prevention. This is to prevent any spread of microorganisms or cross-contaminations. Now that I have performed the proper hand hygiene and the wearing of clean working gloves, I am now going to prepare the medication. Medication. So first I'm going to do is to mix the solution. So we have to mix the solution, especially other solution or some other solution contains a aqueous suspension, which tends to settle if the vial is kept standing. But in shaking the medication, we do not shake it, like literally shake it. And mixing the solution, we do not shake it. Instead, we put it in the palms, between our palms, and rotate it like this. This is to prevent creation of bubbles, because bubbles are contraindicated. So after making sure that the medication is well mixed, I am now going to prepare the withdrawal of medication. So first I'm going to do is to attach a filter needle onto the syringe. This is to filter needle helps to filter the solution, especially if the medication is a pre-mixed liquid from a multi-drug vial, because it tends to have solid particles. So this filter needle will help to filter the solution that is being withdrawn. After making sure that the filter needle is well attached, I'm now going to remove the cover, and this is when we are going to inject an air that is equal to the volume of medication to be withdrawn. So in the prescription, it is said that a 0.5 ml is to be prescribed. So I'm going to inject a 0.5 air onto the syringe. And then after injecting an air onto the syringe, I'm now going to inject it in a rubber cap of the vial carefully, making sure that the bevel of the needle does not touch the fluid surface, or it is above the surface, because if we inject air onto the vial, it helps to prevent creation of bubbles. So now I'm going to inject the air. So after injecting the air onto the vial, I am now going to withdraw the medication. So in withdrawing the medication, we have two methods. The first method is putting the vial flat on the surface, making sure that the the base is lower than the top, and then move the bevel a little bit so that it touch below the surface. This is to prevent withdrawing of air or having air present on the syringe. So after making sure that the bevel is above the surface, I am now going to withdraw the prescribed medication, which is 0.5. You have to do it gradually so that no air is to be injected. So now I have here a medication of 0.5. So if necessary, we can slightly top the syringe so that if there are any air present or bubbles, we can eject it, because it will help to rise the air and the bubbles that is present to the syringe. So now I'm going to slowly eject the air. Okay. So now I have here a 0.5 ml of medication that is prescribed by the doctor. So I'm going to cover the needle using a scoop method. This is to prevent any needle stick injury. So now I'm going to perform the second method of withdrawing medication from a vial. So the second method is inverting the vial. So first before inverting the vial, I'm going to inject an air that is equal to the medication, and then inject it to the vial. And then I'm going to invert the vial. So this is the second method, and slowly, so gradually we're going to withdraw the medication that is prescribed, which is 0.5 ml of medication. You have to make sure that it is within eye level, so that you have to determine that correct dosage is being withdrawn. So as I said, if necessary, we can top or flick the syringe so that air is should be ejected. Okay, so now I'm going to cover the needle, and that's how you withdraw a medication from a vial. The next I'm going to do is to prepare a medication ampule. So first thing to do is, of course, perform hand hygiene and observe other appropriate infection prevention. This is wearing a working gloves. And then after that, I am now going to take the ampule, which I have here, and I am going to flick the upper stem of the ampule, because some solution may tend to be stuck in this part of the ampule. So by flickering it, it will bring the medication down. And then after making sure that there are no medication present in this part of the ampule, I am now going to have ampule opener, but since I don't have that, I'll be using this clean gauze or cotton to break off the ampule. So in breaking the ampule, we have to make sure that it is pointing or bending it away from me or from any others. This is because we are breaking a glass here, so we do not want the glass fragments to be spread away. Also, this clean gauze here will help me or will keep me safe from being injured, or my hands from being injured. So I'm going to slightly bend it off. So now that I have opened an ampule, this sharp thing here, I'm going to dispose it in a proper container, which is the sharp container. So now I'm going to place the ampule flat on the surface, making sure that the flat surface will keep it safe. And then I'm going to get the syringe and apply a filter needle onto it, because we just broke a glass from an ampule. It may contain a glass fragments, and we do not want glass fragments from being present onto the ampule. So I have to make sure that the filter needle is attached. And now I'm going to remove the cup of the needle. And then I'm going to withdraw the medication that is prescribed gradually, making sure that I do not inject air onto the syringe. We can slightly tilt the ampule so that we can withdraw all the medication. So now, if there are any air present, we have to flick the syringe and then eject the air present. So I have no air here, so now I'm going to cover the needle in a scoop method. This is to prevent any needle-stick injury. And then remove the filter needle and dispose it on a sharp container. Now I'm going to perform a subcutaneous injection. So first I'm going to do is to perform a hand hygiene. This is to prevent any microorganisms, transmissions of microorganisms. And then after that, I'm going to provide clients privacy by closing all the doors and drawing the curtains, which I have already made prior to the procedure. And then I'm going to introduce myself to the client, because it helps to establish rapport and make the client feel comfortable. And then after that, I'll be verifying the client's identity. This is to determine that right medication is administered to the right client. So ma'am, my name is Samantha Flornosos, and today I will be your student nurse. May I see your wristband, please? Can you state your name, age, and birth date?
Mariel Mirabla, 20 years old, July 15, 2000.
Okay, thank you very much, ma'am. So, after verifying the client's identity, I will now assist the client into a comfortable position. This is to make sure that they're comfortable while doing the procedure. So, ma'am, I need you to relax your arm and relax in sitting there. So, if the client is uncooperative, we also have to make extra attention in assisting the client. This is to prevent any injuries to occur. And then after that, I'm going to explain the purpose of the procedure, how will it help, or the effects that might come together with the medication. So ma'am, I'll be administering this medication, which is prescribed by your physician. This is to lead you in a fast recovery. This is for your illness. So that's the procedure is all about. After explaining the procedure onto the client, I'm now going to select a site. I have to make sure that the site is free from any tenderness, no swelling, also no edema present. This is to avoid any injury. Also, it can hinder the absorption of the medicine after selecting site. Also, I have to make sure that the site I am selecting is not being used usually, so that no injury can happen. After selecting the site, I'm going to apply clean gloves. So now that I have already applied clean gloves, I am now going to clean the site. I have to clean it in a circular motion, making sure that I start from smaller inches until 8 inches. The circle should be 2 inches wide. So from smaller to wider range. And then I'm going to dispose and put a swab above the intended site. After that, I am now going to prepare the syringe, remove the cup, and discard, remove the needle and put the needle aside. So we have to make sure to avoid contaminating the syringe so that it is kept sterile onto injecting it onto the client. So now I am going to grasp the syringe onto my dominant hand, and I'm grasping it using my thumb and my fingers like this, and then position it in a 45-degree angle. So using my non-dominant hand, I'll be pinching the skin like this, and then slowly insert the needle. After that, I'll move my non-dominant hand and push the plunger slowly. So pushing the plunger slowly will help to reduce discomfort onto the client and minimize stinging sensation. After that, I am going to withdraw the injection and cover the needle using so I have here prepared the swab. So if a blood occur by slowly or gently applying pressure onto it will help to stop the blood. So ma'am, can you hold this for me? Okay, thank you very much. So now I'm going to discard the needle that I have used onto the right container, and then remove gloves, discard the gloves, and apply hand hygiene. So now after that, I'll be documenting the procedure I have performed. So the data that I'm going to document is the medication I administered, the dosage, the route I used, and the participation of the client, as well as its reaction to the medication I administered. So after documenting the data, the procedure I have performed, I'll come back to assess the client once again, and after my assessment, I will then document the data or the client's feeling after the medication I administered. So now I'm going to perform an intramuscular injection. So first I'm going to do is to perform hand hygiene and observe other appropriate infection prevention. And then I'm going to provide a client's privacy by closing the door and drawing out the curtains. And I'm going to introduce myself and verify the client's identity. So ma'am, my name is Samantha Flornosos, and today I will be your student nurse. May I see your wristband, please? Can you state your name, age, and birth date?
Mariel Merable, 20 years old, July 15, 2000.
Okay, thank you very much, ma'am. So introducing myself will help to establish rapport, and verifying the client's identity will help to determine that the right medication is being administered to the right patient. So next I'm going to do is assess the client into a right position, in the relaxed position. So this helps to promote relaxation and reduce discomfort. So ma'am, relax your hand until he is stable. And I need you to relax in sitting, okay? So after that, I'm going, if the patient is uncooperative, we have to put an extra attention or particular attention. It is because it helps to prevent any injuries during the procedure. And now I'm going to explain the purpose of the medication, the effects, and the other relevant information. So this injection or the medication I'm going to administer to you is prescribed by your physician. This is to lead you into a fast recovery and to treat your illness. So explaining the procedure onto the client will help to facilitate acceptance and also to reduce the anxiety that they might be feeling. Then after that, I'm going to select and locate a site, an appropriate site. So today I'll be using the deltoid site for the intramuscular injection. So I'll be exposing now this site. So now I have here the deltoid site to administer the intramuscular injection. So after that, I'll apply gloves. So now that I've already applied gloves, I am now going to clean the site using an alcohol swab. So in cleaning the site, we should do it in a circular motion, starting from smaller circle into a big circle. The circle should be 2-inch wide. So this will help to avoid exchanging of microorganisms. After that, I am going to allow the site to dry, and while allowing that to dry, I'm going to prepare my syringe. So earlier I have performed on how to withdraw a medication from a vial and ampule. So this is the medication I have withdrawn. So after after that, I'm going to remove the cup without contaminating it, making sure that the needle is kept sterile. So if pre-filled med, be cautious, because also avoid dripping of med. If drip, wipe it out using a sterile gauze. And then this is because medication can cause pain, or injection can cause pain. So in injecting, I'll be using a Z-track technique. So in Z-track technique, I'm going to pinch the skin of the patient in a Z-track, like this, pinching it like this. So I have to do it on the deltoid side. Then using my other hand, I'll be the muscle can be pinched if the client is infant or emaciated client. So after that, I'm going to hold the syringe using my thumb and fingers, holding it like a pencil or a pen, and then also holding it right will reduce accidental depression, and we should not pierce it quickly. So I'll be administering it. Now I'll be injecting in a quick motion. So after that, I'm going to move this hand and aspirate the syringe. Aspirating the syringe will help to make sure that there are no blood vessels being injected, or the bevel of the needle is not touching any blood vessel. So aspirate it. If there are no blood came out, if there no blood is seen during the aspiration, I'm going to inject the medicine. So if blood is seen during the aspiration, we have to withdraw the needle and prepare a new syringe. After that, slowly, I'm going to remove the needle and cover it using a scoop method. This is to prevent injury or a needle stick injury. Now that So if bleeding occurs, we have to apply a little bit pressure to stop the bleeding. But the bleeding rarely occurs. And then we have to make sure to not massage the site of injection. Also, I'm going to activate. Can you hold this for me, ma'am? I'm going to activate a safety needle device to dispose them rightly. So I have here a sharp container, which I'm going to dispose the needles I've used, and then I'll remove the gloves I used and perform hand hygiene. After performing the hand hygiene, I'll be documenting the procedure I have performed, which includes the medication I used, the dosage I administered, the client's reaction, the site I used, and those. After documenting those, I'll come back to the patient and ask for the effectiveness, and after that I'll again document. And that will be all. Thank you.